Hello, my name is Dr. Matt Shelton from New Zealand Doctors Speaking Out in Science, nzdsos.com for our website. I have been a medical doctor for 40 years, since 1985, predominantly in primary care and family medicine. My career hit a pothole in 2021 and I haven't practiced medicine since then. I don't have a practicing certificate, but I'm still on the medical register. I'm very pleased to thank my fellow presenters for being part of this opportunity to fill the vacuum provided by responsible ministers during the approval and mandate years when they refused to appear before the Royal Commission in August. The Phase 1 requiree noted that a substantial minority of New Zealanders were affected or harmed by the response. And so this is why we have chosen this title. For our collection of evidential presentations directed at the current Royal Commission Phase 2, Lessons Learned. So public money was used to provide a week of open hearings. So we want to plug the knowledge gap for New Zealanders, and these presentations add to the publicly visible evidence pile that the ICI commissioners have been given already. Most of us here, indeed many Kiwis, over 30,000 at last count, have sent written statements, but there is some new information, and overall what all of our evidence has in common is that it satisfies the Commission's constraint of examining the government's decision making, which is where all the decisions originated, and with whom the responsibility for the final consequences lie, as Rodney Hyde, an ex-minister in the New Zealand government, tells us in his presentation. It is vital that this information is available for the Commission and for the general public now and for future consideration. The report will land in February, and thereafter we will always be looking back at the report and in the light of what is happening going forward. We hope sincerely, of course, that their report stands the test of time. We have seen other governments go through the motions looking to exonerate themselves, in stark contrast to people's inquiries that have taken place in Canada, Scotland, the UK, and here in New Zealand too. So we, NZSOS, presented to the Commissioners in private for a morning, and we did not hold back about what has happened to the New Zealand people. We were unequivocal that many thousands have been injured, badly disabled, and even killed by the most dangerous medical product in history. What we said in our oral presentation in private is recorded on our website though, which you can see. At the end of the morning we were thanked politely, but reminded that ours was just one of a range of opinions that the Commission was hearing. I'll say more about our experience of appearing in the public-facing portion later. And most of what I cover here is in our submission, our written submission, and many others. Now, clearly, as with all information for and against the COVID response, this project's information must be tested and assessed by everyone. And by now, this is largely two groups of people. Those that have looked and find it matches what they have observed, and those that as yet have no idea that it is even relevant to them. But this latter group is getting smaller as more and more people are impacted by the jab harms, directly or indirectly. And NZSOS believes it is an inevitability that what is coming to the health of New Zealand will be on the minds of everyone, but including the commissioners. And now as they write their report, they must be mindful of what will be coming. And this will be a landmark report, as I've stated. There are some absolute truths that we presenters all agree on, and which frankly are now indisputable. And I want to discuss some of these and confirm again that the Commission has much of this information. Even the Commission accepts that adverse effects from the vaccine product, and I use that term under advisement, of course, that they've accepted that adverse effects have occurred, but the Commission has stated that its job is to try and understand any causation. So more on that a bit later. Now, people may argue about the extent of harms, but even the ACC's own payouts for 6 deaths, it is now, rather contradicts, for instance, the Medical Council's position that the injection was zero risk. Now, everyone could see there was an imperative to mass vaccinate the entire country as fast as possible. A whole of government response was commandeered, in which public health messages, largely from just a few people, were handed down as if tablets from God, and with an implied authority which saw very fundamental laws ignored, including by the police. So we are starting to hear about Operation Tala in the UK, in which the police were instructed to refuse any complaints or information on jab harms, and certainly those that might have involved a criminal investigation. Now, our own open letters, around 60 so far in total, to a wide variety of responsible officials since the rollout started in Easter 2021, have included letters to Commissioner, as then was Commissioner Costa, about suspicious deaths in 2022 and ongoing since then. And these are all available on our website. And we feel they do stand as a standalone chronology and evidence trail of who was told what and when. Everyone can argue that there was a relentless messaging that this product was safe and effective. I think we can all agree that, even for pregnant women. But we were told too that we could expect close monitoring of us all by pharmacovigilance experts because of the speed bit of Operation Warp Speed. You know, it was unprecedentedly quick, and there was an acknowledged absence of safety data, certainly long term. My colleague, Dr. Alison Goodwin in NZDSOS, takes a look at a particular process that she has investigated, led by the person who has perhaps reassured us the most, but with concerning and very depressing results. Now, this vaccinologist was called to the Commission, but was not asked nor offered to speak on the issue of causation of vaccine injury by the product, nor were the various other doctors who spoke to the Commission, at least not in the public sessions. But the Commission flagged that it had identified harms that occurred and was interested in looking at causation. Now, both Helen Petousis-Harris, the vaccinologist, and Professor Graham LeGros gave, we say, deceptive information generally to the Commission. So we wrote a letter of concern and complaint, and with corrections. Our experience with the Commission was mixed. I've spoken about the private session. In the public morning, where we presented alongside the Health Forum New Zealand and Voices for Freedom. Now, we'd been asked to prepare to discuss our many attempts to communicate our concerns, but on the day we were steered well away from that and did not have that opportunity. We were asked to agree that MedSafe had only refused initially to approve the Pfizer product on efficacy grounds alone, which we did not because we didn't agree. And also we had it put to us that the WHO had stated 12 billion doses had been given around the world, presumably implying, I guess, or wanting to imply that it wasn't there for an experiment and must be safe given all the doses given. We were then prevented from responding to that question due to time. And in fact, I would say that that was a logical fallacy anyway. So returning to other absolutes that we all agree on, we found out through an article in the BMJ, British Medical Journal in 2023, that the Pfizer product given to the world was completely different from the one in the clinical trial. So MedSafe approved a product that was tested for 6 weeks, and New Zealand signed up for that one, committed to buying it and using it before the data was even completely analysed, let alone published. But then the one delivered into the arms of New Zealanders, and in fact all around the planet, was a different product. Now in biotech, if you change the production method, you have a different product, period, completely different. So there was no data at all and no assessment by regulators. And we have all learned subsequently that there are alarming amounts of contaminant DNA from the mass production process used. And we have the so far unexplained, officially anyway, and barely acknowledged, except by the press perhaps, epidemic of late presenting, rapidly advancing and resistant to treatment cancers, especially tragic, of course, and obvious in younger people. Now, it is clear to us too that this product was always a gene technology injection and never a vaccine. In their risk disclosure to their investors, Pfizer and Moderna both actually are very frank about the gene technology involved and all the unknowns, risks, and possible harms to future profits. Now, labeling their vaccine avoided testing for cancer-causing potential and for fetal development, and allowed a liability shield against future litigations, which all vaccine makers carry, that protection in most countries. So the injection products take over the genetic machinery of the cell to make a foreign protein in untold amounts, certainly unknown amounts, that then gets attacked everywhere by the immune system. And this is predominantly in the lining of the blood vessels. And for durations that have shown so far to be up to several years, and certainly not the days or few weeks that we were told. We, the RCI, judges, police, doctors, all of us were told very firmly that it was all gone in a short period of time, and it stayed in the arm. So we urge the Commission to investigate the government decision to ignore how the injection worked, and thus bypass the Hazardous Substances and New Organisms Act, and what ought to have been intense scrutiny by the Environmental Protection Agency. The Pfizer contract in countries where there has been some release states that explicitly that long-term effects are unknown, and also that it is for the prevention of COVID-19, and that caution is required in pregnancy. Pfizer USA and the UK government, among others, have all acknowledged or all said that there should be an individual consultation with a woman's doctor for a risk-benefit assessment for that particular person, and that there is no safety data for pregnancy. Now, it's possibly not possible to impress enough on the commissioners and everyone else how evil the decision to remove traditional safeguards in pregnancy was. All of our presenters and many of you shot bolt upright in high alarm when that particular message appeared. And the shame is that more doctors didn't revolt, but you can thank the Medical Council for that, as lawyer Sue Gray covers in her presentation. But here we all are, united in our knowing that a truly bad thing must be in progress based on that one move alone. I would refer everyone particularly to Dr. Ursula Edgington's work on exposing the removal of the promised surveillance of jab effects in pregnancy using public money on her Substack, which is informedheart.substack.com, though the main thrust of her presentation here is the use of propaganda techniques and mass psychology to obtain compliance from the population. Now, from that point on, safe and effective in all stages of pregnancy, and I practically choke saying it, there was going to be an inevitable collision with those upholding medical ethics, all medical ethics, but especially the precautionary principle in pregnancy, and for children, of course. To attack this process deliberately is utterly reckless, clearly sociopathic, and for a species, suicidal. So if there is one aspect the country must see the lawyers and bureaucrats inside the Commission engage with, it is this one. And everyone else must ask themselves how they went along with it. The unspoken assumption was surely the benefits must exceed the risks, right? Or we wouldn't be doing it. Wrong. Nowhere was any formal risk-benefit calculation ever carried out, certainly not in the public space. So we've learned of the statistical tricks used in clinical trials to label the recently vaccinated as unvaccinated, and the one trial using very dodgy modelling assumptions in 2021 to say the vaccine saved millions of lives. So that paper, Watson et al., was bunkum and has been thoroughly refuted. But that's all that MPs and many others were told they needed to know in 2021. But there are many hundreds of thousands of papers published on COVID. One presented to the Commission in Auckland tried to summarise all the research on the COVID jab as being positive, and that is simply not true. There is a significant body of evidence which, taken together, is proof that the injections are dangerous and they must be withdrawn. Anyway, it is a norm that you scrutinise any evidence of harm that appears for a new product. You don't turn away and ignore it. So we have all witnessed the attempted silencing of critics and the use of disciplinary processes against doctors, nurses, midwives, even some lawyers who have tried to warn and advocate for the public. The drawn-out, stressful, expensive, and destructive processes are supposed to send a message to others to keep quiet. And the responsibility for this happening lands at the feet of the responsible ministers, particularly the health minister. Clearly, government has enabled regulatory bodies to co-opt entire professions into their mass vaccination narrative, using threats and punishment, and frankly abusing processes left, right and centre. But there are no laws that allow them to do this. For instance, the Medical Council is tasked with one imperative by the Act that governs it: to defend medical ethics. So that is informed consent, do no harm, bodily autonomy, precaution in pregnancy, all down the toilet. Now, first, do no harm isn't just a nice to have. It recognizes that all pharmaceutical products are intrinsically dangerous by design, because they're interfering with something the body's trying to do, and they carry risks. And there is always an option not to use them. Sometimes, and clinical doctors understand this, the safest or the best thing to do is to do nothing and to wait. But suddenly we have a zero risk medical product, in the words of the Medical Council. So what's to lose by forcing that into everyone? Well, apart from some lives and some healthy futures. So these bodies attack people who are following the science of effective treatments for the COVID illness, and for vaccine injuries, for defending medical ethics, and calling warnings of danger to the people. Now, we don't just have an obligation as doctors to the person in front of us. We have a duty to our community, and we are a sort of sentinel early warning system, or we ought to be. But that very important mechanism has been silenced, as has, we would say, the role that the coroner plays in public life, but in alerting the community or informing the community to what's going on in its midst. But as geneticist Guy Hatchard tells us in his presentation, suppressing debate and dissenting voices is the death of science. But it's also the death of democracy. And surely this too must concern the commissioners. The painstaking work of two of our presenters, Erica Whittome and Kathy Jameson, featured here, to submit and analyse OIA requests and responses, paints a disturbing picture that suggests little known or even hidden legal pathways are perhaps being used to cover the irregularities, let's say, in the procurement, the distribution, the labelling, and the monitoring of the vaccine product. So let's come now to our Bill of Rights. It governs how officials and institutions are supposed to treat the public. It should be a safeguard against tyranny and abuse of power and abuse of process, etc. It has an Act of Parliament, but this was not enough, as it turned out, to protect us from the abuse of power and the fear-based decision-making. The Commission needs to examine the shonky processes by which our freedoms and rights were suspended and recognise the lesson that BORA, the Bill of Rights Act, must be hard codified as an absolute in the centre of our democracy. It cannot be suspended for political and pharmaceutical gain. And the processes by which public health orders are allowed to supervene all our human rights and democratic protections should be examined and rewritten. Where major BORA abuses happen, for example, against the most precious, the very right to life, as well as speech and conscience, which means knowing the right thing to do and acting on that, whatever the consequences. The right to choose what happens to one's body. Then when those breaches happen, that's where criminal liability can start. But there seems to be an unwritten code that public officials needn't worry about the Crimes Act. Now, NZDSOS has said all along that continuing on with absolute knowledge that harms are occurring and that more will surely follow looks indefensible to us. A final thing that all of us here agree on is that a proper examination of everything that went on will take place. And if not by this commission, there will be another process. So we urge the commissioners to be courageous and not worry that public trust will be lost in a proper examination. The opposite might happen. trust must be earned and maintained, not compelled. Well, in a democracy anyway. And together with many other thousands of written submissions, this collection of presentations adds to the evidence, we say, of profound wrongdoing against the people of New Zealand. So in closing, governments cannot go around allowing the death and injury to people of all ages at the hands of an unjustified experiment and pretending, ignoring, or even lying that this is happening. And we would say that the presentations in this collection give strong confirmation that this has indeed been happening. Rather than being the single source of truth like it claimed, it seems the government actually had a single response to the truth: silence. And good, conscientious people cannot sit by and watch this happen. Thank you.